Thank you for joining us today as we talk about Medicare coverage for hepatitis B and C screening, as well as the hepatitis B vaccine. May is a Hepatitis Awareness Month, and May 19th is become known as Hepatitis Testing Day. My name is Karen Curtis, and I am a member of the Provider Outreach and Education team here at WPS Government Health Administrators. I'm joined today by my friend and colleague, Aline Sigler. Aline will be monitoring the chat for questions, as well as providing some additional information from time to time. This next slide is our disclaimer. We do our best to provide the most current, accurate information, but as we all know, Medicare rules can change often. The information I am presenting is accurate as of today, but the CMS website should be checked often for updates. This slide also lets you know that questions will be answered based on the information given. That means that if any part of the scenario changes, that could change the answer that was provided. CMS does prohibit recording of this webinar for profit-making purposes, so we ask that you do not record the presentation or take screenshots. This event is being recorded and it'll be posted to the WPS-GHA website on the Encore presentation page, as well as our YouTube channel. So here's a look at what I will cover today. I'll talk a little bit about hepatitis B and C. I'll discuss Medicare coverage, billing of the services, and eligibility. We'll start off with a little background information about hepatitis. Hepatitis B is a viral infection that attacks the liver. It is estimated that roughly 880,000 to 1.89 million people in the U.S. are infected with hepatitis B. Many believe that this number may be higher since newly infected individuals may not show symptoms. Out of those infected, 70% of those individuals were born outside of the United States. Countries which have higher rates of hepatitis infections include Asia, Africa, South America, and the Caribbean. This is a preventable disease if you receive the vaccine. Now, in the United States, the hepatitis B vaccine is part of the recommended childhood immunizations. So here they kind of take precautions, which explains why the 70% of the individuals that are infected are born outside of the United States. Transmission occurs through certain bodily fluids. The most common form of transmission is from mother to child at birth. Other forms of transmission occur when the individual encounters infected blood. This can occur through unprotected sex, exposure to contaminated medical and dental equipment, and sharing needles during illegal drug use. Shops that provide services such as body piercing, tattooing, acupuncture, and even nail salons also need to make sure that sterile equipment is used. The infection can be chronic or acute. Acute symptoms can last several weeks, but when severe, they can lead to liver failure, which could result in death. Some people with chronic hepatitis B can develop liver disease, which can lead to cirrhosis and liver cancer. Hepatitis C also attacks the liver, causing inflammation, which can lead to cirrhosis and liver cancer. It is estimated that 2 to 2.8 million individuals are infected. 66% have reported being drug users, although there are other ways that the disease can be transmitted. Treatment is available. Antiviral medications are available, and some doctors may suggest lifestyle changes, such as avoiding alcohol and maintaining a healthy weight. Hepatitis C is a blood-borne virus, and transmission can occur through sharing needles or other equipment used in injection drug use. non-sterile equipment used in tattooing or body piercing, sharing personal items such as a glucose monitor, razors, nail clippers, or toothbrushes. And although uncommon, the virus can also be spread through sex with an infected person or through healthcare exposures. Now let's talk about what criteria needs to be met for these services to be billable to Medicare. Screening for hepatitis B is covered under Medicare Part B for individuals who are asymptomatic, non-pregnant adolescents, and adults at high risk for infection. The term high risk is defined as persons born in a country or region that has a high prevalence of hepatitis B infections, or persons that were born in the U.S. that were not vaccinated as infants, or have parents that were born in areas at high rates of infection. Individuals who are HIV positive, men who are in sexual relationships with other men, and injection drug users. You could also be considered high risk if you live with a person or if you're in a sexual relationship with someone who's infected with hepatitis B. For pregnant women, a screening test is covered at the first prenatal visit. Hepatitis C screening is covered under Medicare Part B for individuals at high risk for infection and those who were born between 1945 and 1965. High risk is defined as a person with a current or past history of illicit injection drug use, and individuals who receive blood transfusions or blood products prior to 1992. For the hepatitis B vaccine, this is also covered under Medicare Part B for individuals who are at an intermediate or a high risk for contracting hepatitis B. Those at intermediate risk for infection include staff who work at institutions for those who have intellectual disabilities and healthcare professionals who have frequent contact with blood or blood-derived bodily fluids. Individuals who are considered to be high risk for infection include end-stage renal disease or ESRD patients, hemophiliacs who have received factor 8 or 9 concentrates, patients of institutions for the intellectually disabled, homosexual men, injectable drug users, and those diagnosed with diabetes mellitus. You could also be considered high risk if you live in the same household as someone who is a carrier for the hepatitis B vaccine or virus, sorry. So next we're going to talk about how to get these claims submitted to Medicare. Codes used for screenings are listed here. Code G0499 should be used for individuals who are asymptomatic, non-pregnant adolescents, and high-risk adults. The remaining codes that you see on this slide are used for pregnant women. A single one-time screening is covered for individuals who fall within the asymptomatic, non-pregnant, high-risk category. And annual screenings are covered for high-risk beneficiaries who have tested negative but continue to be considered high risk and they have not received the hepatitis B vaccination. So maybe somebody who is like a drug user, they test negative but they don't want the vaccine, that would be somebody that you would look at for annual testing. And the term annual for CMS means that 11 full months have passed following the month which services were received. So if the beneficiary was screened in January of 2024, you're going to count start counting in February for the 11 full months. And that means that they would be eligible for their next screening in January of 2025. For pregnant women, one screening is covered at the first prenatal visit and is appropriate for each pregnancy regardless of previous test results or vaccinations. A rescreening at the time of delivery would be appropriate for individuals with new or continuing risk factors. When it comes to diagnosis codes, your claim is going to need to include code Z1159 regardless of the patient's situation. If the patient is ESRD, then you would also need to include diagnosis code N186. Initial screenings for asymptomatic individuals should include the Z7289. Subsequent screenings would require a high-risk diagnosis code. So on this slide, I've added a link to change request 12377, which lists the high-risk diagnosis code starting on page 22. There was just way too many for me to even try to reference on the slide. For pregnant women, excuse me just one second. For pregnant women, claims should also include a pregnancy description code. And by pregnancy description code, I'm referring to the diagnosis codes that describe if it's the patient's first or if it's another pregnancy and what trimester it's in. For high-risk pregnant patients' claims, you should include diagnosis code Z1159 along with Z7289 and then one of the codes you see listed here on the slide. Diagnosis code requirements can also be found in the Medicare Claims Processing Manual, Chapter 18, Section 230.3, and I have provided a link to that chapter on the resource slide. If you submit claims on a UB04 or an 837I equivalent, the applicable type of bills include a 13X, a 14X, a 72X, and an 85X. If you are an ESRD facility submitting charges on a 72X, then you're going to want to be sure to include that diagnosis code N186, and you're also going to want to use modifier AY. For those of you who submit claims on a CMS 1500 or an 837P electronic equivalent, you're going to want to make sure that you include a provider specialty and a place of service listed on this slide. I won't go over all of them since I have them all out here for you. Hepatitis C screening should be billed using code G0472. This test is covered once for individuals born between 1945 and 1965, and an initial screening for high-risk patients who are currently or were formerly injection drug users. Additional screenings are covered annually only for people who continue injection drug use since having a negative screening test. The diagnosis code should reflect the patient's reason for receiving the test. So if you have a patient that was born between 1945 and 1965 who's not considered a high-risk patient, then you would use code Z1159. If the patient is a high-risk adult and this is their initial screening, you would use the Z7289. And if it's an annual screening for a high-risk adult who has previously tested negative, you would use diagnosis code F1920. For providers who bill using FIS, services should be submitted on type of bill 13X, 14X, or 85X. Providers who bill using MCS will want to include the following provider specialties and place of service when submitting their claims. Now here's a look at the codes that would be used for billing the hepatitis B vaccine. The code G0010 is for the administration, while the remaining codes would pertain to which vaccine the patient was given. Claims should include diagnosis code Z723. Now, as you can see, for those who bill FIS, there are quite a few type of bills that can submit claims for the vaccine. I do want to be sure to call attention to the 12X type of bill, which is a Part B claim for a patient that is an inpatient in the hospital. When submitting charges for the hepatitis B vaccine, you're going to want to make sure that you use the day of discharge as your date of service. That's going to avoid having that claim deny for overlaps. Also on the UBO4, the 837I, you'll use revenue code 636 for the vaccine and code 771 for the administration charges. Payment for the hepatitis B vaccine is included in the Rural Health Clinic all-inclusive rate and the Federally Qualified Health Centers PPS rate. A visit cannot be billed if the vaccine administration was the only service provided. Charges for the vaccine and its administration can be included in the line item for a qualifying visit. Now, the Medicare Claims Processing Manual, Chapter 9, does give some examples of how claims could be submitted, and I'll have place a link in the chat, but it did kind of break it down. It showed the qualifying visit, and then it showed how to bill for the vaccines, and it also included charges and what the payment would be for those claims. So that would help out if you want to get some further information on that. For those of you submitting professional services, the hepatitis B vaccine should be administered under a physician's order with supervision. The ordering or referring physician's information should be included on the claim. And you will need to choose which specialty code and place of service best describes your individual situation. So new this year, there is an in-home vaccine additional payment. This service is available for certain Medicare patients who have difficulty leaving their home or struggle to get vaccinations in a setting other than their home. For calendar year 2024, the additional payment amount is approximately $38. This amount is paid in addition to the standard administration amount, and Medicare will geographically adjust this amount based on where you administer the vaccine, and the annual updates will be made to the payment rate to reflect changes in cost. Claims should include code G0010 for the administration and code M0201 for administering the vaccine in the patient's home. No additional services should be provided, so the sole reason of the visit should be to administer the vaccine. Medicare will not make any additional payments for other Medicare services that are provided in the same home on the same date. There are multiple qualifying locations. This can include a private residence, an assisted living facility, a skilled nursing facility. When I was looking at the documentation, they'd even cover, like if you went to a homeless shelter and gave the vaccine there. I have included a link on the resource slide so that you can get details related to the service. The last topic I would like to talk about today is eligibility. Checking eligibility before providing these services can help avoid frequency rejections. So we want to go over how to do that. We do have a few options for checking patient eligibility. The first is the Interactive Voice Response System, or IVR. You can say eligibility, and after providing some beneficiary information, preventive services is one of the information choices that is available. If you have access to the WPS portal, you can receive next eligibility dates for the hepatitis B and C screenings. For providers using the FIS system, if you don't have access to the direct data entry system that's known as DDE, there are forms on our website where you can request access. And then once you have that, this will allow you to access the beneficiary's common working file records. And there's like 16 pages of eligibility information out there, and it will provide you with the dates for the hepatitis B and C screenings. The last option I have here is the HIPAA Eligibility Transaction System, which is known as HETS. And this requires providers to register as a trading partner with our EDI department. Many of you probably have done that because that's the way you would submit electronic claims. Now, eligibility information is received by submitting a 270 electronic inquiry file, and the system will then provide a 271 response with the information, and it'll show you the next eligibility date for those screening services. This last slide is a list of resources. So if you'd like to get more information on any of the topics discussed today, I did include a link to the Medicare Preventive Services tool, which I find helpful regardless of the preventive services that you're looking for. If we go out here real quick. Aline, can you verify that you are seeing the Medicare Preventive Services tool?
Correct.
Okay, great. So if I go out here, I can click on like hepatitis B screening. It gives you a link to the national coverage determination. It also lists the codes, the HCPCS or CPT codes. It lists the ICD-10. And here's the one where it gets into a big long list for the high risk codes. There's a lot to choose from there. And it gets down into the frequency. They also have the hepatitis B for the administration, goes into the different codes. Here, the other notes, this is the link I provided you stating about the additional payment. And it does give you the vaccines that they will do this for, But if we scroll down here, tells you what bill or what codes to use. Here's where it lists all of the qualifying locations. And I apologize, I said Medicare skilled nursing facility, but that does not qualify. It'd be an apartment complex, an assisted living, a group home. Those would qualify. So I do apologize for saying that. It does have other restrictions that may apply. So if this is something that you are interested in or something you might do, you'll want to be sure to check that out. Okay. I didn't really receive that many pre-submitted questions. I received a lot about diagnosis codes. So hopefully I covered that information for those of you that asked for that. Aline, have we gotten anything that's come through on the chat?
We did, Karen. Thanks for that great information. We got a question from Tiffany, and this is regarding the hepatitis B screening. She has a provider who order the hepatitis B screening for their elderly patients. They're not pregnant, obviously, and they're not high risk. And when they order that, they say, we'll request testing for Hep B and C and HIV, considering the fact that these viral infections may mimic autoimmune connective tissue diseases and may represent a contraindication for future immunosuppressive therapy. So that's what the physician or the practitioner is stating when they order it. And she asks, since these patients don't meet the Medicare criteria, should they be obtaining an ABN, or are there instances where they would be able to appeal? I'm sorry, Karen, are you on mute?
I'm sorry. Yes, I was. That is a very good question, Tiffany. And what I would like to do is I would like to take the information that you provided and I would like to check with our clinical staff because they would be able to look at the reasoning that was given and kind of see where we can go with that. So I will do that. I will check in with our clinical staff. I'll provide them with the information that you gave me, and then I will respond via email and get you an answer for that.
Okay, and I know you're going to check on that, and we'll watch for that. I just want to add a little bit here that, you know, in general, if you have an item or service that is covered by Medicare, but you know, within reasonable expectations, know that Medicare would not cover it for this patient in this instance, an ABN might be appropriate. And then if you give an ABN, the patient would always have the right to appeal. So that's just some in general information just to take for food for thought while Karen gets some more information from the clinical staff on that. And let me look here. Robin asks, can labs be billed through a rural health clinic?
Are we just talking like general labs? Is that?
Robin, could you add a little bit more information in the chat for your question? Otherwise, we can take that back also and reach out and get a little more information for that if she's still on the line. And that's all the questions. Oh, I'm sorry, she just popped in. Hepatitis labs for type of bill. I'm still not sure we have enough information there. We might have to touch base with Robin outside of this call for that one.
Yeah, I can touch Robin. I can get back to you on that. Okay, if that's all that we have for right now, I will move forward. Well, I want to thank all of you for joining us today. I will get back have some follow-ups with those questions, so I will get back to everybody. On behalf of Provider Outreach and Education, thank you for joining us. We look forward to your survey comments, and we hope that you will join us for future events. You may now disconnect.